Welcome to the Low Back Pain Lifetime Elimination Program. My name is Dr. Nick Hunter. I'm a doctor of physical therapy, and I own and operate Preferred Physical Therapy, where we help people aged 40 plus stay active and independent, live free from painkillers, and avoid surgery, even if they've had pain for years. This video is going to be perfect for people who have that morning pain in the back. I get a lot of folks who come to me because they've had this discogenic type pain or herniated disc, and when their episodes are acute and they're in a lot of pain, the morning is the worst, especially that first 20 to 30 minutes in the morning. What we need to do is curb that pain. We need to get out of that cycle, and it's very easy to stay in it when we hop out of bed and go right to the bathroom, whatever it is that we're going to do. So what we want to be able to do is slow it down a little bit, give you a few tools, a few movements to do in bed before you get out to help minimize that pain and minimize that irritation cycle that keeps us in that painful situation. So what you're going to do is you're going to start in bed, because this is where you wake up. Before you get out of bed, just easily, if you haven't already, move your legs up, bring your knees up into this position. Very easily start to rock your knees side to side. Bring your feet together, bring your knees together, and just easy move side to side. Now you're going to notice they won't go very far at first. That's okay. Don't rush it. Don't get into too much of a feeling like they need to go further, or it's not good enough, I'm not satisfied with that. Just be patient with it and let it move side to side. Typically 2 to 3 seconds, side to side, working it back and forth just like I'm doing. Maybe 5 to 10 of those is all that you're going to need. Next, we're going to do knees to chest. I like just doing a simple one at a time, knee to chest. Notice we're not moving fast. We're not holding for very long. We just need to get moving. Our body's been stiff all night long. We need to get moving. 2 to 3 seconds of a hold at the top is about all that you're going to need. Do this 10 times. And then next, I want you to work this pelvic tilt. We're going to go over in more depth in future videos. Bring your hands at your hips and just rock your pelvis back, and then begin to rock it forward. Now, as you go forward, be very, very careful. Almost like we're trying to bring, if we had a belt on, our belt buckled down to our ankles or to our feet. So you think about pulling that down, and then pull the belly button or belt buckle up towards our chin or our nose area, and then back down to our feet. We're just beginning to work some easy movement, easy mobility. Because in the morning, the discs in our back have the most time to rehydrate, meaning that they refill and swell. Now that's totally normal, that's all right. We're always tallest in the morning, and that's the reason, but we're also most painful in the morning if we have any kind of discogenic type pain. So what we need to be able to do is help to soften and loosen that up, so as we go to stand up, we don't load those puffy discs and cause more pain and tension across the backside. So once we've done these pelvic rocks back and forth, we start to do a few bridges. Again, nice and easy. We're rocking that pelvis down and back, pushing through our hips and glutes. About 5 to 10 times, smooth and steady. Then I want you to scoot over away from the edge, and we're going to barrel roll up, which means that we bring our knees to the side, follow with our shoulders, bring this hand up to the top near our face, let our ankles come off the table. We're going to dig in with our elbow on the downside, push up through our hand, and then come up into a seated position. And from there, we should be in a much more comfortable space to then get up and carry on for the rest of our day. But take 5 minutes in the morning, go through a few of those movements, get up nice and easy. That helps to mitigate pain through that low back. Really crucial to get out of that pain cycle and into that cycle of health.